Hey, well, hello everyone. It's wonderful to have you joining us today. My name is David Hebner, and I'll be hosting the webinar we have today on finding your impact with the County of Santa Clara. I'm joined by a wonderful group of panelists, but before we get to them, I am first going to go over some housekeeping items and that we want you to be aware of as we get started. So the first one is that the recording will be available afterwards. So this event is being recorded, and you'll be able to watch it online at your leisure after the event today. As far as discussion is concerned, the panelists will answer questions submitted in advance through our event registration, as well as answer a number of questions that we have for them. We also have the ability for you to submit live questions, and we have a great team who will be answering questions. You can type them into the Q&A box on Zoom, and our team will be there to answer them in real time. If you have questions around streaming, if you're watching on LinkedIn, Facebook, Instagram, or YouTube, please note that we're not monitoring those platforms live. So if you have questions, you can email us at deisourcing@esa.secgov.org, and we'll get back to you as soon as possible. And then if you're looking for career opportunities, which we hope you are, you can look for the QR code during the event and scan it, and we'll take you to career opportunities, as well as an opportunity to learn more about the recruitment process and about the county. So now that we've addressed some of those housekeeping items, we want to get to know you, our audience, a little bit better. So you should be seeing a little screen pop up that will allow you to answer a poll that will help us understand who's joining us today. You can now imagine the Jeopardy music playing in the background while you answer the question. We'll give folks a few more seconds. Amazing. Well, great. Well, it's really wonderful to see such breadth of experience with a third of you actually coming from the federal government. That was one of our hypotheses coming into today, is that we might have a lot of people joining from the federal government. We appreciate your service and everything that you're doing. We know that this has been a really difficult time and are so appreciative for you joining and having interest and learning more about the county. And one of the questions we will talk about is also what it looks like to transition from federal and state government to local government. And our panelists have actually that as part of their background. Which brings me to now getting to actually introduce our panel and tell you more about the content of today's session. So one update we wanted to let you know is that David Campos unfortunately can't join us today, but we're so incredibly lucky to have Casey Halcon, the Deputy County Executive, joining us today. So thanks again, Casey, for stepping in, and thrilled to have you part of this group. As I mentioned, my name is David Hebner. By way of background, about 10 years ago, I left the private sector. I was working in tech in people analytics. I was really interested in understanding what it would look like to apply what we were doing there in the public sector. And so about 10 years ago, made a transition, working mainly with local governments. I've now been at the county for the last 8-9 months running our people function here. And part of our mission running the people function here at the county is attracting and growing great employees. And so part of this event is finding great people out there who are interested in joining the county and having impact. And as a way of attracting you, we want to make sure that we're telling the stories of people who have found impact and purpose with the county. And so we have 3 great speakers joining us, and I'm going to let each of them introduce themselves, and I'll start with Casey.
Good afternoon, everybody. My name is Casey Halkin. I'm a Deputy County Executive. I've been with the county with this county for about 10 years. I've been a deputy for about 3. And prior to my experience as a deputy, I was the first director of victim services for the county. I've had the privilege of working with 2 counties in the state of California and also with a brief stint in nonprofit organizations when I was running victim services there. So very pleased to be with all of you today, and I'll turn it back over to David.
Thanks, Casey. Dr. Rodman?
Hi, good afternoon, everyone. I'm Dr. Sarah Redman. I've been with the county for almost 9 years now, and before that, with the California Department of Public Health. And I'm an infectious disease doctor by training, but transitioned into the public health world as soon as I figured out that this job exists and this opportunity to take what I know and bring it to county government. But I think what was the more meaningful transition for me was to the local level from working at the state level and the on the ground impact that that's let me have. So, my current role, I oversee our infectious disease and emergency response work for the public health department and get to work closely with the colleagues you see today. Thank you.
Thanks, Dr. Rudman. And Laura.
Hi, thank you. Thank you, David. I'm really happy to be here with all of you today. I know these are difficult times. I spent the bulk of my career in public service. I spent over 7 years at the U.S. Department of Health and Human Services in Washington, D.C. And prior to that, I was at local government at New York City Department of Health and Mental Hygiene. Now I'm at the County of Santa Clara. It's another very large local government. So I've been able to see sort of both sides of that work and some of the benefits when and being on either of the larger federal government or the smaller local government where you really have that boots on the ground impact. Really happy to be here and answer your questions.
Thanks, Laura. As you mentioned, this is a pretty large local government. So just for context for folks, we serve about 2 million people. We have about 24,000 employees across dozens of departments, 2,000 different job classifications, which leads to quite a bit of diversity and variety. So to start off with, I'm actually going to ask maybe Casey, if you can talk a little bit about what your department does and how it fits into the system and what drew you here.
Sure. So my background is largely in criminal justice. And so my portfolio includes most of the large criminal justice agencies in the county. So I'm the liaison to the Office of the District Attorney, Public Defender's Office, and Independent Defense Counsel, probation, pretrial, and also the Department of Child Support Services. Given my background in working with vulnerable families, I'm also the liaison to our Department of Family and Children's Services, and I also oversee our Children's Advocacy Center work and what we are calling trauma recovery and critical incident response, which is a relatively new and unique program here. And I'm also opening the county's first Office of Violence Prevention. So quite a lot for DCEs. We sort of split up the various departments around topic areas. And one of the things that drew me here is my background is in serving victims, but my family has a long history in law enforcement. So I think my public service really comes from my family. My father was born in Mexico, but was a police officer here in the United States. My grandfather worked for what would be considered Mexico's Department of Justice, and so served on both sides of the border at different points in his career. And I think that that's really what motivated my work. And now at this stage, I really appreciate that Santa Clara County has a more holistic view, particularly with criminal justice. So when we think about criminogenic factors and the underpinning, many of those same, and I'm sure Dr. Redmond could talk about this, the social determinants of health that make somebody more likely to be a victim of crime are also the same things that make somebody more likely to be a perpetrator of crime. So we really take a more holistic view of how we serve anybody who's justice involved, and that speaks deeply to my experience and also to my passion. And I think the other part about my career that I think is important to me is I get to do a lot of work, particularly now under the federal administration. I'm doing a lot of work around planning for family separation and also some of the concerning developments around our LGBTQ members of our community. I'm very proudly the daughter of a lesbian mother and was raised with her along with my father. They were divorced, and that's a complicated story for another time, but was raised in both settings. And that rainbow family has meant a great deal to me and my upbringing. And it's a passion and an area of interest and love that I can bring into my work in a county, and it's deeply important to me.
Wow, thank you, Casey, for sharing that. And I think it really connects to this notion of finding real purpose
Mhm.
in your work and having found that here. Um,
Absolutely.
Dr. Rudman, do you want to speak a little bit about your department, how it fits into the system, and what drew you?
Sure. Well, I think 5 years ago, I spent a lot of time explaining to people what a public health department does in a way that I mostly don't have to anymore. But I think it may not surprise many of the folks here that what we do goes well beyond monitoring and preparing for and responding to infectious disease pandemics. So as Casey described, we have a huge amount of work that involves violence prevention and recovery, climate change and impact and resilience and preparation, chronic disease and injury prevention. And so really anything that can impact human health, to the extent that we can face that problem by starting with population level data, community level input, and population level changes to try to make impact, our purview at some point. And I think part of why I was drawn here in particular was twofold. One is I think I moved from individual level clinical care as a doctor to wanting to sort of move, as we talk about in public health, upstream, not wait till somebody's sick, but say, what can I do to keep them from needing a hospital visit, keep them from needing a medication, and not just treat one patient at a time, but wherever I can, treat an entire community, entire neighborhood, entire county. So that drew me first to the California Department of Public Health, where I had a fabulous first position. But I did find myself really as a conduit between federal expertise and resources and the folks that felt like they were really on the ground at the county level, really connecting directly with the communities who are being impacted, hearing what solutions work for them and what solutions just miss the mark on what they actually need, and executing on them, not just seeing what's the latest guideline and what is the evidence behind that guideline, but how we're going to get it done. And so I think that became very apparent to people during the pandemic or at the local level. The actual getting the work done was the hard part, not sort of what the work should theoretically be. Well, that's still very complicated. And here in Santa Clara County, I don't think I knew it until I was here and settled that I can't imagine doing this work anywhere else, because in terms of finding a way to impact public health and wellness and create equal opportunities for health across the diverse population we have, Santa Clara County comes with a level of resources, but also great need, given the really marked diversity and disparity of the community we have here, as well as an environment where science and justice are supported. So I can't imagine working anywhere else.
Thanks so much for that. And you spoke a little bit about the transition from state to local. Maybe I'll just pivot quickly to Laura, who made the transition from federal to local, just to talk a little bit about what that transition looked like before moving on to our next question.
Sure. So, as I said, I had been at New York City's, which is again a very large government, and then gone to the federal government. I think coming to from the federal government, where you have such a very large, broad view of the entire country, when you come into a local government, you really get to work in a way that is much more intimate with the local issues, with really impacting people's lives, and you really can't do it at federal level. And I think really being able to develop, especially in a county like Santa Clara, where the commitment to the community is so profound and so committed, that is like an amazing thing to do, because we can pilot really innovative programs and actually get immediate feedback and find out if that approach works. And that has been really exciting. Over the last 8 years, we've done so many things that would be very difficult to do at the federal level. And that's very exciting.
Thanks, Laura. And maybe I'll stick with you for the next question. You sort of talked about one of the great things of working at local government, and this one in particular is looking at how do we set a standard for other local governments in California and beyond. Can you speak a little bit about what excellence in public service means to you, and maybe sharing a story or an example of a time when the county set that standard of excellence?
Well, so many. So we're unusual in that we're actually a fully licensed health plan that provides care not just to county employees and their families, but also to the public through Cover California. And so the county made that commitment to run its own Cover California plan. We have 24,000 members in Cover California. And it's a very arduous program to run. And we've actually just made that commitment to do that so that we can provide a very low cost option for Cover California that would not otherwise exist. And that's been, it's a lot of resources to actually make that happen. But that's just one example of a commitment the county made.
Fantastic. And Casey, maybe I'll pivot to you for you to share an example of where the county has sort of set that standard of excellence in public service.
Yeah, I just wrote down something that Dr. Redmond said about where a place that believes, science and justice matter. And a couple of years ago, I got a mug for some of my colleagues, and it said, "Good government is good people." And I think that we really are committed to a few different tranches of what it means to us to be excellent in public service. One of them is we hire the right people. And, this is a very collegial environment. Like, I'm sure we are coming across as warm and welcoming, and that is not by accident. That is by design, because that is who we are. And I think we make, speaking as someone who works in administration, high EQ, high empathy, high passion for service is an important part of what we do and what we hire for. So I think that's a really critical component, and I think that leads to better standards in public service. I think we also really prioritize the experience of the client. So in this case, our community, and really think about ways in which we can improve systems and processes to allow for greater and better access. We're also thinking about smaller, more niche populations that are really important to us in our community. We have an incredibly diverse community. We want our workforce to reflect that, but we also do things that lead the way. So for instance, we were the first county in the country to open up an office of LGBTQ affairs. And that remains an incredibly important hub for work in this community. They lead the country and certainly our county on some of those efforts. That's part of what we call our Division of Equity and Social Justice, which is led by Dr. Ana Lilia Garcia, who's just remarkable and brings a lot of lived experience and deep commitment to the work in running our division. And certainly, and Dr. Redmond can talk about this, our work on COVID. And I think that we really take deep pride in serving our community. And I will just note that doing what is right is not always what is easy. And in a time and a place where doing the right thing can be hard, it's a privilege to work for an organization that does what is right, not what is easy.
Well said. And your point around who we hire being really representative of our values really is something core to our mission as part of the Employee Services Agency as we think about designing the right hiring processes and attracting the next generation of public servants. So we've been talking a lot about the diversity of programs, many of which are unique to our organization. Dr. Rubin, can you share an example of a county program that demonstrates that breadth of impact of our work?
Sure. I mean, I can think of a lot. One that comes to mind immediately is the Good Food Purchasing Program, which is one that we participate in with other federal partners and state partners. But the concept being that if you make certain changes to the way hospitals or other large agencies buy and serve food, you can not only make impacts on the nutrition and therefore health of the individuals who consume that food, you can have major impacts on climate change because you can purchase more locally and decrease both the carbon footprint of the food you're buying and how it gets to you. You can make positive economic impact because you're purchasing local food, and you can make positive economic impact on the large agency that is saving money on these cost-saving measures. And so the Public Health Department, through its expertise in both nutrition and climate impact, has been working with our very large healthcare delivery system to make sure that these food purchasing changes are happening across our system. And so as a public health leader, it's especially exciting to be part of a county that operates such a very large and very high quality healthcare delivery system. I think the second largest in the state after Los Angeles, but obviously for a county much smaller. And so we have this opportunity to make massive amounts of impact in the healthcare service delivery sector just by working with our internal county partners, never mind the additional hospitals and clinics outside. So that's the kind of intersectional work that we'll do where it's not enough to just look for nutrition benefit, to just look for climate benefit, to just look for economic benefit, but where you can cross these sectors and rely on the expertise we have in all of these sectors across the county, we can make really dramatic positive change.
If I could just jump in for a moment on that, because I think what's really remarkable about the county is not only does it have this incredible commitment to diversity and equity, And it's not going to take a step back on that. It's going to continue along that very important path. But we also are really cutting edge on technology. We have all of our hospitals, and there will be 4 in a couple of weeks. We're buying another hospital. It will go live April 1st. All of them are on Epic, on an EHR. They were early adopters of Epic pretty much when the meaningful use force came out. We actually, as the health plan, were one of the first health plans in the United States to implement Epic Tapestry, which is their health plan module. And we went live, on time, on budget, and we're very successful. We've achieved NCQA accreditation. Like, we are at the forefront. It's not just that we're doing the public service work, but we're also doing it with excellence and with really amazing technology. Across the board, the hospitals have the Da Vinci machine that does like incredible stuff with surgery. The hospitals at the county have really amazing services. For example, one of the best rehabs in the United States, the only burn unit for like 100 miles, level 1 NICU. So it really amazing services. And I think it goes to how committed we are, how we focus on hiring the right people, to go back to that, and how we understand that technology is a really important, necessary but not sufficient, right? It's a really important piece of it. But it is, I think, one really shining example of why we're unique.
And highlighting the ways in which we lean into the spirit of innovation, obviously reflective of the environment around us, comes through not only with technology, but in other innovative ways, which I guess transitions maybe to the next area around innovation and different forms of innovation. And Casey, maybe you can speak to one county program that it is innovative or the first of its kind in the region or the nation.
Yeah, so I'm going to speak about 2. So I think first and foremost, we were the first, and currently we believe we're only one of 2 counties of the 3,069 counties in the United States. We allocated $5 million prior to Inauguration Day in order to help our communities prepare for the incoming administration. We knew we would see deep pain and quite a lot of changes. I don't know that we could have anticipated what we're seeing now. It's on a pace that I think even surprised us. But that said, we did that again in advance of inauguration. We had plans in place. We are very forward thinking. And a lot of credit goes to, I don't know if we have any lawyers on the call, but a lot of credit goes to our county counsel's office, which is one of the biggest public service law firms in the state and is just remarkable in its sense of heart, along with the very large brains that occupy that floor. But I think they're doing incredible work for the right reasons. So I think that's one really important program that we're doing. More of a nuts and bolts program. I unfortunately, as Director of Victim Services, responded to 2 mass shootings in our county within 2 years. And that is not an uncommon experience, sadly, for many jurisdictions across the county. And after that experience, I thought to myself, we have to do this differently and better because we were seeing so much pain lasting for such a long period of time. And I think this touches a little bit on what Dr. Redman and Laura talk about, where we think about the well-being of our community, not just in the wake of tragedy, but what does it look like to actually build resilience? And so we developed the first trauma recovery program. So we actually have a clinical psychologist that works in the CEO's office and is here to provide assistance in the wake of critical incidents for our departments, for our communities. If people that could be fire, flood, earthquake, mass shooting. It can be all those unfortunate climate change issues that we're seeing, some of the really awful things that plague this American life. And we are trying to do it better. We are trying to bring in resilience, mental health care, trauma work, therapists, really forward-thinking practices so that we're not just helping somebody in the moment of tragedy and then walking away, but really trying to help them over a period of time. And I think that's also really important for mental health as we're seeing really decreasing rates of mental health across our nation, really demonstrating to our communities in pain that we are here for them, we want to be here for them, and we have programs in place to help. And as far as I know, we're the only jurisdiction in the country to be doing that work.
Wow. I know, Dr. Redman, you have some examples of innovative programs as well. Do you want to maybe share an example?
Sure. I think, again, we stood out as a county during early pandemic response. But I think that theme of not being afraid to do the right thing, and thinking outside the box and how we can do so came up just a couple of months ago when we've been trying to figure out at a local level, how do we prepare ourselves for H5N1, for the bird flu that we've been seeing sweeping across the country, knowing that we span the geographic diversity from Silicon Valley to highly agricultural areas, knowing that we could be hit just as easily as other parts of the country in terms of needing to protect our farm workers, our poultry workers, our dairy workers. But as the work to really keep an eye on that was sort of falling to federal partners and systems that were outside of our jurisdiction, saying, what can we do with the resources we have? How can we play a role beyond just waiting for a federal or a state indication of a larger problem and reacting to it? How can we be on the lookout? And so one of our talented staff members, our director of our public health lab, developed a way before it was available anywhere else in the country to be able to test raw milk, so unpasteurized milk that was legal for sale in California, in our county public health lab in a way that was not available at state public health labs. Only rare FDA labs and affiliated labs had the ability to do that. And with that, we began our own additional surveillance because we knew that this would tell us about potential outbreaks that hadn't been detected yet, as well as risks to our county members. And we did successfully, unfortunately, but we did find actually on multiple occasions raw milk that was for sale, available to be drunk in our county, that was contaminated with H5N1 bird flu, which led to multiple product recalls, early detection of multiple large cattle outbreaks, and ability to protect the workers who are otherwise at risk long before the usual systems might have picked up at them. And so in a similar vein, I think our public health lab, though being one of several across the state, and not a state-run lab, is one of only 2 in the entire state that are currently able to test for several viruses that cause Ebola or Marburg, which is a similar virus. And so for those of you who are following that there are outbreaks of these diseases happening in several African countries right now, and wondering whether the federal systems we typically rely on will be as robust as they have in the past to be able to alert us and protect us from effects here locally. We are the only place in California north of LA able to test for these viruses and able to make sure that not only our jurisdiction will know what we're experiencing as soon as it gets here, but supporting our neighbors in that way.
Great to see that. And as you're saying, we have to be adaptive and nimble as we see what's happening at the federal level and realize that that might change the way that we think about how we do our work, and especially if we want to ensure that we're providing services to our incredibly diverse community. And I think that's another theme that really rings true working here, is that we're serving a pretty diverse community in terms of backgrounds, but also just in terms of the diversity of the county. The county has some much more rural areas to the south, and then a large city in San Jose, and then all the different cities in between. And that diversity of community, I think, impacts and affects the way that we think about our work. Laura, maybe you can talk a little bit about how do you, as the VHP, ensure your services are accessible and effectively connected to the diverse and culturally rich community around us?
It's really important. I mean, part of it is that we need to have really robust language services, which we do, so that we can make sure that we can communicate to our members in all the different languages that they speak. And also that we help our providers be able to access those language services as well. When they come upon a language that they don't speak or no one in their office speaks, we actually can provide them with the services that they can use for language assistance with patients who can't speak English. So that's one area. We do a lot of work, and we actually will work across, both the health system and reach out to public health, even if we want to work on various initiatives. One of the big issues, and I think that was spoken about earlier, is behavioral health. Behavioral health is really a critical area. And so we've actually built a case management team specifically focused only on behavioral health as sort of a subset of our case management team. And so that's been a really critical area as well. And making sure that we have both nurses and social workers and community health workers and who can really work with members one-on-one to help people navigate care and become healthier here mentally.
Thanks, Laura. Casey, can you talk a little bit about the ways in which you see ourselves supporting the diversity and the culturally rich community?
Yeah, I mean, I think that people don't often think of San Jose or Silicon Valley as being a particularly diverse place, but we have, outside of one particular zip code in New York and Brooklyn, we have the second most diverse zip code in the nation. Um, I think it's something like over 50% of the babies born here have one parent who's an immigrant. We have multiple households where English is the second language. We have a huge swath of our population that is Southeast Asian and Asian. We have another swath that's Latinx. And I think that not only do we support the populations we serve, we hire people from those populations. And so I think that if you were to look at our workforce, you would see a lot of diversity. And that is also true with LGBTQ. So we have a lot of allies in different places in leadership, people who have cultural experience, cultural reference points. And those of us that don't, I think we expect some cultural humility from our leaders and from our staff so that we can go in with thoughtful questions to support the community. I don't think any of us develop these systems of service in a silo. We do a lot of community engagement. I mean, a lot of community engagement. We are out there often and frequently on a variety of issues. And I think that that is also really important is that working in Silicon Valley means, well, I'll take that back. I don't know about working in Silicon Valley. Working for the county of Santa Clara means that we have and we expect the community to judge our work as they should, because we are developing these systems for them. And that comes part and parcel with the work that we do. And I think we really live by that across all sectors of our county organization.
No, it's so true. And one of the things that we're doing within our employee services agency is really connecting the data we have about our workforce to the larger population with this true belief that to better serve our population, we need a workforce that is reflective of it. And that's a cornerstone of our work as part of the people function here at the county. Before shifting to some of the questions that have been submitted online, I guess for the panelists, I have one last question. One of the themes that obviously has come up is that this is a time where everybody is adapting to a new reality. And I think it'd be important for folks to maybe understand what how the county is adapting to the new federal administration, what the county is doing, and in a world where things are shifting quickly, how are you as leaders staying up to date and trying to ensure that your services and departments are addressing the new needs that are emerging? Some of those themes came up, but I'd love for you all to speak a little bit more about that. Laura, I'll start with you.
Sure. So, we have 4 lines of business. We have Medi-Cal, Covered California, county employees, and then we have a program that is really the county's charity program for those folks who can't be one of those programs, usually for documentation reasons. And we've fortunately seen a shrinking in that program because of expansions around our other programs that have been open now. For example, Covered California under President Biden became open for DACA, and there was the state move to have undocumented in Medi-Cal as well. These things will likely change. I think we can all agree in the coming year. And so we're already proactively looking at our membership and trying to identify how we're going to make sure people get care. So just because people don't have insurance, we know that doesn't mean they're not going to need care. They're not going to end up in the emergency department. We don't really want that to happen. We want them to have a primary care provider and a medical home, even if they don't have coverage. So we will likely move to expand our primary care access program, and we're already working on ways to ensure that that coverage will still be there. We obviously, I'm on top of as much of the news as I possibly can be. We meet with our entire team every month, all 350 employees, and we do go over all of these changes that are happening. Obviously, everyone here is super concerned about what's happening. And even though it's 3,000 miles away in a lot of places, we all know that federal employees work everywhere and are being impacted all over the country, including right here in Santa Clara County. So those are a couple of ways that I'm staying on top of things and trying to work on this.
a lot to keep track of, but I think we all know how much it impacts our day to day. Casey, do you want to talk a little bit about what you're doing?
Yeah, sure. I mean, this morning I was at a convening for our LGBTQ plus community, and um, we've been hosting convenings with our immigrant community as well as we seek to adjust. We are also asking for their input in the areas in which their community that we may not be tapped into. Although many of us in the county and some of us on this call identify in various ways with the communities being impacted, I think it's really important for us to make sure that we're hearing directly from people who have kind of boots on the ground experience. So we're doing a lot of that to make sure that we're on the right path. I think this is uncharted territory for certainly our county organization, and we are doing our best to sort of build the plane while we fly it. And we realize that our community is doing the same. So I think it's really important that we're doing it together and not in opposition. So I think that's one step. I also think that what makes this county unique is even though every organization has a hierarchy, right? Like you see titles and titles matter to some extent. Um, we also roll up our sleeves. So you may see different leaders in the organization picking up the phones one day in certain places and being at food banks in other places and being at community convenings in different spots. And I think that we are not afraid to ask all different levels and layers within the organization to do really important work and to make sure that we are out in community being seen and hearing directly as well. It doesn't have to be good or bad. I don't want it to sound like we are only seeking positive reinforcement. I think that we need to hear about gaps and we need to hear about when we're not meeting the need. That is just as critical in helping, if not more so, in helping us design those systems. So I think that is going to be really important for us as local government and as community as we build a future together. Our scope is, as local government, we have a certain scope that we can seek to protect, and those are the residents and people here in Santa Clara County. But I think we take that charge and that mission extremely seriously.
Yeah, absolutely. We take it seriously, and I think as both of you highlighted, and as this whole discussion has highlighted, we need to be nimble as new realities emerge. Well, I appreciate everyone's great answers to all these different questions, really telling the story of how you found purpose and how you're finding impact with the County of Santa Clara. And hopefully these stories and narratives have been helpful for all of you who have joined. We now want to shift the discussion a little bit. We know a number of you submitted questions online, and a lot of the questions submitted were more about about the county or you've learned about the county. You want to better understand what a career might look like here or how even you find a job. So with the team, and a huge kudos goes out to the team, Cassie and Oriana and the whole team that put this event together. They've put together a number of resources on career opportunities, how to find jobs, and how to navigate the application process. We're not going to go through those in too much detail here because we have a landing page which is getting shared via the chat where you can find videos with tips and tricks on how to apply, as well as other information about our incredible benefit programs and the opportunities that do exist here. But in the last part of the discussion, we do want to shift to what does the day-to-day look like, and what are some of the things that that came up in questions that we think our panelists can share information about that tell a little bit more about what their recruitment processes look like and how they've grown with the county. So one of the areas that came up, or one of the questions, was around hybrid work environments. So just to give a little bit of context around that, the county does offer hybrid and flexible work schedules, but it does depend on positions and on departments. As you can imagine, with 2,000 different job classifications and dozens of departments, the work looks really different. Therefore, we need to have a work environment that is adapting to the type of work that is being done. So that's something that you can learn about from some of our job postings, but also by asking questions as you go through an interview process. You'll learn more about what is available from a hybrid standpoint. There are no fully remote opportunities here at the county. And one thing that is true is that you do have to work in the state of California. So that is something that is a requirement to join the county. Another question that's come up is how have people navigated sort of career progression at the county? And actually, I'm going to hand off to Casey to talk about your personal narrative on that front.
Yeah, so I'm one of those statistics. I often joke and say that I was the not the obvious choice for deputy county executive in many ways. So I'm very grateful for the position I have. But I started off my career in county work as an extra help employee at the front desk. So I was in between jobs, college graduate. My father was really upset that he'd paid for a bunch of my, helped to pay for my college education. And he was like, you will take any job that you can get. And I did that. And it happened to be as an office assistant, extra help office assistant for the district attorney's office in victim services. And I fell in love. And I worked my way from office assistant to advocate to senior advocate to director, and then to deputy county executive. So I do think that we have a strong history of promoting from within and also from promoting people who come in and up. And the reason why I think that's important is because I think a lot of people want the dream job, and I understand that. I applied for a particular job for a number of years and did not get it until I did. But I also think there is real value in coming in when you can get in. And then we tend to have a lot of movement within our county departments. We really see that from administration. And I think that's really important because people can bounce around in certain areas of interest and passion areas in order to get the experience they need to be able to promote from within. And I think that's we like to keep all of that institutional knowledge within the institution to the extent that we can. So don't be afraid if you're early in your career and you don't know exactly what to do, get in where you can get in. And I don't think it'll be a bad decision. I do think we have a lot of opportunities and a lot of flexibility within the departments. And I think that's been the experience for a lot of my colleagues. You know, one of my deputy county executive colleagues just recently promoted to another job, having been a former deputy director of public health, then a deputy county executive, and now a director of an agency. So I think that we do that quite often.
Yeah, just to put a number on that, I think, and thanks to Adrian for having pulled this number, apparently 76 county employees have been promoted to executive positions over the last 5 years, which I think tells the story of growing our leaders from within. That doesn't mean that everyone does grow from within. There are also opportunities to join the county at different stages of your career, as I did, but it does say that there is a culture of growing folks within the county. And so if you are middle of your career or earlier in your career, I think you can really see this place as a place where you can grow. And what I always say is when you look at local governments, the diversity of experiences you can get, as Casey was sort of highlighting, is so great just because there are so many different departments doing so many different things. You can get a lot of variety all staying within the same organization. And I think that's part of why you see a pretty high retention rate within the county, because a lot of people are actually hopscotching their way, but it's all staying in within the same umbrella organization. Now, some of you are probably wondering, well, how do I get an application in? What are some tips and tricks? And I know Dr. Rudman, you in a previous call I was on, said that you've been counseling people on how to help them stand out with their application and during interviews. I'd love for you to share some of your tips.
Sure. Well, I think first, before needing to stand out, I didn't understand when I transitioned from academia and private sector to my first government job, how standardized the process is in order to make sure that everyone gets a fair shot at every application, that there is a first passive review to make sure you meet what's called minimum qualifications for every job. And so making sure that you describe the experience you have in a way that makes it clear to somebody reviewing it why you might meet those minimum qualifications. So as you look through any posted job, what does it say is the required job experience, and making sure, if it might not be obvious, what role you've had in the past that would fulfill those requirements, making that very explicit. And so once doing that, I think on top of that, really just explaining why you want to be here. I think this is a place where a lot of people would love to come work. And as Casey was describing, we are really looking for people who fit the same level of energy and flexibility and passion for the work that you're seeing us share authentically today, because I think we really love coming to work, even amidst some of the crazy times we're working in right now, and showing what drives you to want to do this work. The other thing I think is sometimes it doesn't have to be that you have done the exact job that you are applying for, that you are, you don't have to have had that title. You don't have to have done exactly that work in your prior job. If you can show an understanding of what the work will entail, and an understanding of how you've gained those skills maybe in other settings, and what you would need to learn to be able to transition the skills you have from elsewhere to this new setting. I find that people who can articulate that are often really successful, because it shows not only do you have the skills to do the job you're applying for, but you know exactly where you'll need to hit the ground running in order to learn what you don't already know. But other than that, I think the last piece that wasn't intuitive for me is just some of the way we do our hiring, in terms of we hire the same job title in different sectors. So if you say, my passion is caring for justice-involved folks, and I really want to work in the jails as a health educator, and you see a health education job posted in the hospital, still consider applying for it, because we may be recruiting for multiple health educators at the same time. And the jail, the second they have a job open up, may say, ooh, who applied for that hospital position? Let's see if they might be a good fit. So don't hold back just because it's the right job in the right setting. Keep yourself open to those broader recruitment opportunities, and that might make you eligible for exactly the right dream position when it does open.
That's such a great point. And there are a number of job classifications where we hire at a county level, right? For example, management analysts or office specialists. And so throwing your hat in the ring does potentially open up a number of different doors by just applying once, whether that be initially or, to your point, Dr. Rudman, down the road. So definitely encourage you to think of that as being an entry point that then might open up other opportunities in the future. Those are great tips and hopefully helpful to our listeners today. You started touching on thinking about how do you translate the work that you've done from potentially another sector. Maybe I'll shift over to Laura to talk a little bit about what advice do you have for individuals transitioning from the federal government or from other sectors? I think about a third of the folks joining today were from federal, but also some with private sector experience. But maybe talk a little bit about what advice you have for those folks.
So in terms of transitioning from the federal government, I think the application process will be very familiar in a lot of ways, although maybe a little bit more to the older process in the federal government. It was like the knowledge skills assessment that you needed to do, because I think they kind of did away with that a little bit. I think that's definitely an area where you'll have to, definitely draft a lot of information of what you've been doing. In terms of the environment, I think what's really exciting about being at the county compared to the federal government is that you're really able to dive deep. So a lot of times when I was in the federal government, there would be, something would happen. I remember when the Flint, Michigan disaster happened with the lead in the water. And like, you're trying to take your part of your agency. At the time I was at the Office of the National Coordinator, like, what can we do to help in that area? And it's hard because you're kind of removed from the actual issue, unless you're a directly responding agency. Whereas at the county, you can really dive deep into an issue and really focus on what's happening in the community, which makes it very different. And in terms of what your work will look like on a day-to-day basis. And I think that's what's really exciting about it. It very much similar to the federal government. It's a lot of relationship building. In the federal level, you're building the relationship across agencies in a lot of ways. At the local level, you're building relationships both with your sister county agencies, which we certainly work very closely as a county, even as big as we are, but also with community stakeholders. There's a lot of stakeholder engagement and a lot of stakeholders, period, in a county of 2 million people. So there's a lot of building those relationships with the community in a way that you wouldn't do in the federal government as much, or even maybe at all. So I think that's a definite difference that you'll experience.
Yeah, there's definitely, I started my career in the federal government, and there, while some similarities in like the hiring process, yet there are differences in that connection with the community that you're operating in, I think is one large difference. Dr. Rudman, I know you were at the state level. For people transitioning from the state to hear, any quick words of advice that you want to share?
I mean, for me, it really was just an opportunity to see the impact of the work I was doing. It felt so much more tangible when I could join a community meeting and hear whether the new state or federal guidelines were going to make sense here, make sense for this community, what had been missed, what had been misstated, what had been misunderstood. Likewise, everything we do here in Santa Clara County's Public Health Department is grounded in our local data, in our local community input. And so here's an example. I do a lot of work in overdose prevention. Many of us are aware on the West Coast, we are seeing a very different pattern of methamphetamine use and impact from methamphetamines than where most of the East Coast and middle of the country is really being almost solely impacted by opioids. And so we're understanding that that causes a completely different pattern of response we need when we're keeping people safe from overdose and death related to drugs here. And that's not something, even when I worked at the state, I was mostly finding myself receiving federal level guidance and trying my best to pass it on at the local level, but not always having the on the ground knowledge and on the ground input I needed to see what I was missing. Whereas here it's built into every day. It also requires a level of problem solving I didn't always have to have at the state, because I was really, it wasn't just what should we do, but how are we going to do it? Which agency is going to carry this out for us? Which community partner is going to help us gain the trust we need to support a particular neighborhood who's being disenfranchised or underserved. And so I find it that much more rewarding when we have to actually solve the problems, not just talk about the solutions.
Yeah, there's a lot of problem solving, and especially right now. Maybe Casey, I'll just shift to you to talk a little bit about, for anybody who's joining who has more limited experience, how can someone with that limited experience successfully apply for a job, and talk maybe a little bit about that?
Yeah, I mean, I do think, to Sarah's point, getting in where you can, when you can. So even if it's right job, not the perfect department, do it anyway. Even if it's maybe less than what you're qualified for, do it anyway. Because I'll say I've interviewed people that applied for a lower level job that I thought, actually, you're better for this job, and I've been able to help direct people to other applications and vice versa. So I think that that is really important, is that we can help people navigate the system in a way that makes sense. I think internships are a great opportunity. I think our extra help is a great opportunity. So when we have extra help positions, internship positions, it's hard for people, especially if you're relocating, to do temporary. Sometimes we have some of those positions as well, but it's a great way to get experience. If you are really just a recent college graduate interested in government work, get volunteer hours in something related. So if you're interested in overdose prevention, if there's a clinic that you can volunteer at, if you're interested in justice involved and you want to be a prosecutor, why don't you volunteer at a law clinic? Things that you can do outside of the scope of traditional paid employment that for us as a hiring body would still count as experience and would dedicate and show your dedication to the clients that we serve and the work that you're doing. So I think that volunteering is a great way to build up your resume. I think internships are a great way. Again, to Sarah's point, apply for the job, not necessarily the department, because of how our systems work. You have a lot of flexibility to move within them. So I think those are all great opportunities for people who are interested in getting involved.
Well, and Casey, I think that underscores just the breadth of experiences, again, that you can get here, the different entry points. And that is another piece that we want to stress, is there are a number of different entry points. You can start as extra help, as Casey was highlighting, which is a way of starting on a temporary basis. You could potentially start in a different role that might look a little bit different. We really encourage you to lean into those opportunities, because as we highlighted, it can lead to then these incredible careers embodied by Casey's. And those of you who are joining, who are coming from other worlds, hopefully Dr. Rudman and Laura's stories of coming from other parts of the state and federal government resonate with you, or mine having come from the private sector. We really do believe that the county embodies an organization where you can really find purpose and have dramatic impact on this incredible community around us. We encourage you to apply, or even just sign up for notifications to hear about opportunities. We always know this might not be the right moment for you, but we really want to develop a relationship with all of you as we think about your career longitudinally, and hopefully you'll find the right opportunity. So with that, I just want to extend a huge thank you to our panelists, Casey, Dr. Rudman, and Laura, for joining. It's amazing having all of you as colleagues and having you share your stories and your stories of impact with this audience. I also want to take this opportunity to thank the team that organized this. There are almost 20 people behind the scenes that all made this happen. So a huge thank you to all of them, spearheaded by Oriana and Cassie. Thank you for your work. Cassie's actually sitting right here beside me. And lastly, before everyone leaves, there will be a short survey where please don't hesitate to give us feedback. We want to do more of these to really engage with the community to see how we can be helpful, especially with so much going on right now. We want to be an active partner helping you all in your career progression, and hopefully that will intersect with the county at some point. And with that, we wish you all a wonderful day, and thanks again for joining. Take care.